Hello, this is Senator Ben Cardin on Facebook Live, a program that I try to do on a periodic basis so that the people of Maryland can hear from experts on a timely subject and we can have a discussion as to what is happening in our community and how the United States Senate and Congress is trying to respond to these issues. So today I'm very proud to have with me two real experts in the area of COVID-19 and our virus and to help us walk through the current status, particularly as it relates to our young children. I have Dr. Ruth Cardin, who has two professorships, if I understand it correctly. She's in the Department of Pediatrics, the School of Medicine at Johns Hopkins University, as well as a professor in international health at the Bloomberg School of Public Health. So she's an expert from the point of view of the medical school as well as public health on these issues related to our vaccines, particularly as it relates now to our young people. And Dr. Sharon Hoover, who's the co-director of the National Center for School of Mental Health, University of Maryland School of Medicine, who can help us understand why we've seen a significant uptick in mental health issues affecting young people during COVID-19. And we hope that this discussion will lead to what we can do to help protect our children and our community in regards to the direct impact of COVID-19, as well as the impact it has on their mental health. So welcome to our two experts. And Dr. Cardin, if I can start with you, tell me a little bit about what you've been doing for the last year and a half, other than trying to get on as many WebExes as you possibly can. What have you been doing? And tell us a little bit about this most recent announcement concerning our younger children.
Well, first of all, thank you so much, Senator Cardin, for hosting this WebEx, for the invitation, and for everything that you've been doing for people in the state of Maryland and in this country with respect to COVID-19 and combating this pandemic. So I'm a pediatrician, as I think you've heard, and I've spent a lot of my time working on respiratory virus vaccines. So you can imagine that this was an interesting moment for us all. My Center for Immunization Research at Johns Hopkins has been very much involved in the COVID vaccine effort. So we've performed studies in adults as well as studies in children. And I myself have led a CDC sponsored household study of the impact of COVID-19 in households with children under 5. So it's been a busy time. I have to say that this is really a great moment. It's for children and for their families that we're now able to vaccinate children over 5. I think, as everybody knows, and very thankfully, COVID has had it causes severe disease much less frequently in younger children than it does in adolescents and adults. However, over 8,300 children ages 5 to 11 have been hospitalized with COVID and 172 have died. And having the vaccine available really gives children and their families the very best opportunity to be protected.
The numbers are pretty high as far as the number of infections. The numbers are relatively low as far as the seriousness of the illness or death. But as I understand it, if a young person has the virus, even if they're asymptomatic, they have no symptoms, they can still spread the virus to other people, including those who could be particularly vulnerable to the virus itself. So to protect our children, we want to get them the best protection as possible, including the vaccine, but it also does another thing, and that is protect our public health.
That's absolutely right. It protects people. It protects other children. It protects people who are older who may not have had as good a response to the vaccine because of their medical conditions, and it protects our very, very youngest children who we hope will be vaccinated sometime in the not too distant future, but don't have vaccine available to them yet.
Sometimes we lose sight of the magnitude of COVID-19. I think we all know the impact it has on our personal lives about uh, our socializing with other people and postponement of weddings and those types of issues in our travel plans. But 47 million Americans have been affected by COVID-19. That's an extremely high percentage of our country. 750,000 deaths from this disease. It has changed life expectancy charts. COVID-19 has had a direct impact on the quality of life in America. And we still don't know the long-term impact of those who have been seriously compromised by COVID-19. In my state of Maryland, the numbers are about 550,000 Marylanders who have been infected with over 10,000 deaths. Now, I must tell you, one of the big upticks that I've seen is in the mental health services. I serve on committees in which we've held hearings on this. Congress has provided substantial revenues, funds in order to try to supplement our mental health budgets so that we recognize that we have a significant challenge. We recognize that in our school age population, particularly a significant increase in the mental health challenges. So I'd like to learn a little bit more about why that is the case. What has COVID-19 done that has made children more vulnerable to mental health challenges? And I'm very proud that we have Dr. Hoover with us, who is, as I mentioned earlier, is the co-director of the National Center for the School of Mental Health at the University of Maryland School of Medicine. So Dr. Hoover, walk us through what the challenges have been for our children in their mental health as a result of COVID-19.
Certainly, and I would like to echo Dr. Karen's gratitude to you, Senator Cardin, for all you're doing in Maryland and across the nation to support our young people and families and communities as they try to navigate this complex time. And certainly, as you said, one of the great complexities in the context of COVID right now is the mental health impact. And it's not surprising in the context of the tremendous uncertainty of COVID, as well as the layers of health burden and economic burden that families are going to suffer. And one of the ways that they're suffering, both adults, but also our youngest members of families, our children, are suffering in terms of their mental health. And there are many reasons that's happening. We know that when there is physical illness, often mental illness accompanies, right? So there are just layers of mental health issues that come with physical health issues. When families are suffering economically, when we have job loss, when we have large impact in communities, we also see an impact on mental health. And when parents or caregivers' mental health is suffering, there's also often suffering of children's mental health. You also mentioned just the disruptions to our daily routines. And for our youngest ones, our preschool even, and our school age kids, they've had significant disruptions to their routine. And that can interfere with their ability to develop those social emotional competencies that are critical in the school age years. And that can really interfere with their ability to function and also just with their general well-being and mental health. You know, one of the silver linings that a lot of folks talk about in the context of COVID is that mental health has almost become a universal discussion. Folks are now able to talk about the mental health impact of COVID, but also just mental health in general. And all of us in some way are impacted. So we hope that one of the silver linings will be a reduction in stigma around being able to talk about mental health and mental illness, and also just the ability to seek help when needed.
Well, yeah, I appreciate, I think you're right about that. We've had a much more robust discussion about mental health. Uh, so I'm just curious, what do you do to minimize the risks to our children during this period of time? We have to adhere to the public health guidance. Therefore, our schools were not operating at full capacity and in full service. The type of programming has been dramatically changed for our young people. We've also had the challenge of families not being able to do their normal activities because of COVID-19, again, disrupting the routine for children. So how do we, during the virus, we're still in the virus, what do we do to minimize the risk to our children's mental health?
Well, I'd actually say one of the most important things we can do to minimize the risk for mental health is to actually eradicate or at least minimize the impact of the virus itself. So one of the things that we can do is to encourage our families and our young people to get vaccinated. And I know that Dr. Karen can certainly speak to the strategies around childhood vaccination campaigns. So I wonder if starting there would be a good place. And then a lot of parents are asking, well, how can we talk to our young children about getting the vaccine, right? They're scared. We got 5 to 11-year-olds who might be worried about getting a shot. So I'm happy to speak to the mental health implications of that and maybe how parents can talk. But I wonder if Dr. Karen, starting with just how we can, really encourage childhood vaccination as one measure for protection around mental health would be a good place to start.
Dr. Karen, I'm going to throw it back to you, but I want to brag a little bit about Johns Hopkins, if I might. Every place I go in the world, I see the logo of Johns Hopkins. You are the gold standard on the numbers that we're using. And of course, so much of the work in regards to the vaccine development took place not only at Johns Hopkins, but the University of Maryland. So we have and we have companies that have been directly involved in the vaccine development here in the state of Maryland. So we're very proud of the Maryland roots in regards to vaccine development and distribution, and it's been an incredible effort. So we know a little bit about the effectiveness of vaccines in the adult population. Can you just share with us, since tomorrow is going to be the first full day, I think, that we're going to see the 5-year-olds, 5 to 11-year-olds actually being given shots in the arm. Tell us a little bit about how important it is for young people to be vaccinated and how safe it is.
Of course. And first, I want to say that I share your pride in everything that people in our state, investigators, public health officials have accomplished. Really so important. And of course, industry, people working together on these issues. Second thing I wanted to say is just a little something about how these vaccines were evaluated, and then maybe I can wind up with Dr. Hoover's question about how do we roll these vaccines out, and how does that help us then improve the mental health of our populations by getting children vaccinated. So we first evaluated these vaccines, the Pfizer vaccine in particular, which is really what we're talking about at this time, in adults, and then in teenagers, in those age 12 and over. And as you probably know, there are many, many thousands of individuals who are involved in those trials, and subsequently thousands and thousands of individuals who've received those vaccines. We then, Pfizer worked with investigators to move down in age to this 5 to 11-year-old age group. And because we know, and this is just something we as vaccine experts know, children respond better to vaccines than adults as a general rule, something that maybe not everybody is really aware of. They're stronger, they're more vigorous, and their antibody responses are better. And so in order to minimize side effects, when Pfizer evaluated these vaccines, they started with lower doses. And the vaccine that we have approved for 5 to 11-year-olds is, as you probably know, it's a third of the dose that we give to teenagers and to adults. The trials in the 5 to 11-year-olds were about 3,000 children received vaccine. The side effects that we saw were actually very similar to the kinds of side effects that we saw in older children, teens and adults, in that we saw some low-grade fevers, some achiness, and some feeling tired for a day or so. But generally, these vaccines were well tolerated. One thing that probably it may be that parents of these younger children may not be aware of, but I think is good to know, is that over 248 million doses of the Pfizer vaccine have been given in the US, and of those, about 7 million to teenagers. So we do have a wealth of experience that goes beyond our clinical trials. And maybe finally, just to circle back to Dr. Hoover's question and comment about how we get these vaccines into the arms of children. One of the things that the White House has been promoting that I think is so very wise is to vaccinate children in what we call their medical homes. So to send them back to the pediatric practices where they've gotten immunizations, where they're known, where pediatric providers, doctors, nurses, physician assistants, and others in the practice are trusted and know the facts about these vaccines and know how to best communicate with children and parents and to answer their questions.
So I want to back up to January. I'll give you a chance, Dr. Hoover, in 1 second. And I'm going to ask you, I think, specifically about this. Backing up to this past January, when the Biden administration took office, we had very few Americans vaccinated. We didn't really have a distribution plan on how we were going to reach out to the community, either with information about vaccinations or sites in which they could be vaccinated. So this has been really done over the last 10 months. We've really developed a pretty comprehensive system. I introduced legislation early with Senator Menendez about the concern of equity in how we were handling COVID-19, because minority communities were much more vulnerable, and the healthcare facilities in the minority communities were not as strong, and we were concerned about the distribution of vaccines as well as therapeutic drugs fairly in our country. We just recently were on a phone call with the White House person on this, and it was interesting that the percentage of minorities that have been vaccinated is slightly higher than the percentage of the non-minority community. And that, I think, is a testament that we've been able to get the vaccine out in traditionally underserved communities. So we're now dealing with 5 to 11-year-olds. I believe there's somewhere around 28 million children in the country that fall into that category. So it's a large group. It's a different audience. It's not going to be, the youngster is not going to come into and get a shot. It's going to be through their parents or through where they are, and you're going to need all types of, you need a support system in place. How do we deal with those types of challenges? And I think I'll start with Dr. Hoover here for a moment, because I think part of this is how children react, how parents react. Part of this is dealing with the area of your expertise. What type of strategy do we need in order to get children vaccinated fairly in this country?
Yeah, I mean, certainly what you mentioned in terms of the distribution and vaccination campaigns are absolutely critical. And it is incredibly impressive to hear about how the inequities in vaccination distributions have been navigated, and many successful outcomes have been achieved through those efforts. But oftentimes we want to think really about that kind of parent-child dyad first as a starting place. We have parents who are uncertain themselves and young children who may be worried about getting a vaccine, getting a shot in their arm. So as a parent, and the advice that we can give to parents is, first, remain a good listener, right? Remain noticing what your kids are saying about the vaccine, but also about their daily lives, any fears that they may have, any worries or distress. They have been concerned about lack of access to friends or frustrations about not being able to enjoy previously enjoyable activities. So one thing to note with your children is that this can increase their ability to actually be able to engage with their peers. And sometimes when they know they're going to maybe be able to get back to things that they used to be able to enjoy, that might motivate them to get that shot to stop COVID from impacting their lives in the same way. Parents can certainly explain to their children that getting vaccines are one of the most effective ways of preventing and preventing getting COVID and also spreading it. I've heard a lot of youngsters say that, you know, they feel like they can protect their grandparents by getting the vaccine. So that can be an incredibly powerful message. Parents can also address that while the shot may feel scary, it's just going to be a brief moment that might hurt, and they can model for the child getting the vaccine themselves or having older siblings get the vaccine. You can always remind your kids that they've had multiple shots before, likely, and that they've successfully navigated that. Dr. Karen mentioned the primary care home or the pediatric home being the place for young children to get the vaccine. And one of the most important messages that I think we can get to parents right now is that this is a really important opportunity to reconnect with your primary care provider. A lot of families have fallen behind on their regular vaccination schedule and stopped routine and preventive care during COVID. And so even if they might be hesitant at this point about getting a COVID vaccination, it's important for them to reconnect with their primary care physician at this point and re-engage with their standard vaccination schedule as well as COVID vaccines.
So Dr. Karen, older people, they had some reluctancy, but they saw the statistics and they knew that if they got COVID, they could get really sick and perhaps die. The adult population was a little bit less anxious to get the shots. It took a lot more work in order to get the general population vaccinated, and we're still a work in progress. We're not at the numbers we want to be at. It's clear to many of us that younger people, they're not at the same risk, and therefore it might be a more challenging sales point to get them vaccinated. So first, let's talk about how effective is the vaccine in keeping a 5 to 11-year-old free from the virus, and what is the chances of a serious reaction to the shot versus the possibility of getting sick or very sick from the virus itself.
Yes, so let me comment on those, but I also wanted to just follow up on something Dr. Hoover said, because I thought it was really important about re-engaging with your primary care providers. And just to make the point that actually you can get COVID vaccines along with your routine immunizations. So if you've fallen behind for some reason, this is also a good time to catch up, just to say that. In terms of the safety and the efficacy of these vaccines, so the data that were presented, and I think, you know, it's funny, I've served on committees that were really obscure before the COVID pandemic, and now the alphabet soup of VRBPAC and ACIP, everybody seems to kind of know what those are. But the data that were presented to the FDA and to the CDC and their committees for review there were data about the antibody response to these vaccines, the safety of these vaccines, and then some preliminary data about the efficacy of these vaccines. The data about the antibody was all of these data, I think, were very positive data. So the data about the antibody really showed that the antibody response of these younger children was absolutely comparable, was actually slightly better, but statistically we would call it pretty much the same as the response of teenagers to the vaccine. There's preliminary data that suggests that the vaccine efficacy is about the same as in teenagers, which hovers around 90%. So this is highly, highly effective. Some of the safety data, I think I mentioned before that there is this kind of, there can be low-grade fever, there can be feeling a bit achy and a bit tired for a day or two. Those reactions were comparable in this age group to what was seen in teenagers. I know that a concern that a lot of parents have expressed for their teens initially, and now I've heard people express for this younger age group, is around something called myocarditis, which is an inflammation of the heart muscle. It's a very, very rare complication of these vaccines. We've seen it primarily in 18 to 29-year-old men after their second dose of an mRNA vaccine. If it occurs, it is very short-lived. And the thing that I think is also important to remember is that COVID itself can cause this heart inflammation, this myocarditis. So it's important to understand the risks and the benefits in that context. But I think we have data, as I mentioned, we have data in over 3,000 vaccinated children, and then we also have data that we can rely on in over 7 million teenagers that helps give us a level of comfort as we move forward. I also did just want to say one thing about there's frequency and there's absolute numbers, right? And it is, of course, true. I mean, I still can't quite wrap my mind around the magnitude of the effect of this pandemic in terms of hospitalizations and lives lost in our country and all over the world. And certainly we have fewer numbers, thank goodness, in children that contribute to that whole. But still, the kinds of numbers that we've seen in children, this is, this I believe has become the 8th leading cause of death for children in this country, right? And the fact that we've had 8,300 children hospitalized. So it's a smaller number, but it's not a trivial number. And I think we really need to remember that even as we think about protecting children themselves and protecting those around them.
Dr. Karen, just to underscore that point, during the early stages of COVID-19, when we saw the hospitals were overcrowded with COVID patients, the demographics were generally older people that were in the hospital. When we look at it more recently and we've had hospitals that have been overcrowded as a result of COVID-19 cases, and when we've had the surge in the last couple of months, that we see that the demographics is much younger because the older population is much higher percentage of vaccinations than the younger population. So we're seeing that those that are not protected by vaccines are ending up in our hospitals at much greater numbers than those that are vaccinated. And if I understand the point that you're raising, in addition, for young people being vaccinated, so they don't affect their grandparents or their parents, and that we can help control the spread of COVID-19 in our community, which is an extremely important public health necessity for many reasons, including mental health, that was pointed out so well by Dr. Hoover. But from the individual 5-year-old or 7-year-old or 9-year-old, the benefits of being vaccinated is so much greater as far as preventing a severe medical outcome than a consequence of having the vaccine creating a significant health problem for that infant. I think that's the clear evidence that has been presented to date. So from the individual's point of view, it's in their own personal health interest. And I know that we all want to do everything we can to keep our children safe. We talk about that frequently. So as a parent or a grandparent, it's our responsibility to keep our children safe. And where I would hope every person in our community would be vaccinated, we certainly have a responsibility to make sure our children get vaccinated. So I'll make that plea. I'm still want to come back in one moment to the distribution, because I don't think it's quite as easy. It'd be one thing if every child in America had a regular visit to their primary care doctor, but that's not the case in America. So I want to know how we overcome that challenge. I first want to acknowledge again the two guests I have on Facebook Live, Dr. Ruth Karen, who is the professor in the Department of Pediatrics at the School of Medicine at Johns Hopkins University, as well as a professor in international health at the Bloomberg School of Public Health at Johns Hopkins. And Dr. Sharon Hoover, who's the co-director of the National Center for School of Mental Health at the University of Maryland School of Medicine. So how do we overcome the equity issues when we know that many children don't have scheduled visits to primary health care providers? Who wants to take that one on? All
Well, one
right.
of the things I can certainly jump in just in terms of the work that we do at the National Center for School Mental Health at the University of Maryland School of Medicine. We work at that intersection of education and mental health and health. And one of the opportunities that we've leveraged over the past several months where we've been able to distribute vaccinations to our teen population is to use the school site. We have a number of school-based health centers, for example, and just school sites that have opened their doors as vaccination hubs for communities. So that's one of the ways that we've been able to really promote the school as a hub for vaccinations. We have federally qualified health centers that are partnering with schools. We've had schools that serve as drive-up vaccination venues for young people. So I will say in Maryland and beyond, communities have been incredibly creative about how to get shots in arms of young people so that we can really promote public health. I know the approach is different with our 5 to 11-year-olds in that we're really advocating for those to be delivered in the primary care context. So it's going to be a different approach that we take. So Dr. Karen?
Yeah, I think the only thing I'd like to add to that is this is not the first time that we've thought about using or actually have used schools to deliver vaccines to children. We, particularly in the state of Maryland, in many schools have given flu vaccines to children every fall in the context of schools. And I think that this is, first of all, I think it's a great opportunity for children to get influenza vaccine as well as their COVID vaccine if they haven't already gotten their flu shot. But it is another, I think, important approach to trying to close that gap that you're mentioning, Senator Cardin. I also would say that many of our larger clinics, children's hospitals are also opening their doors and encouraging children to come get vaccinated in those venues as well.
So I have a question in regards to the other vaccines. What I understand, the 5 to 11 has only been approved by the Pfizer vaccine, not by the Moderna or J&J. And as we know, in the adult population, we take 2 shots, and now we have a booster. Do we know what the protocol is going to be in regards to the Pfizer vaccine as to needing additional shots after the first? And secondly, do we have a game plan on other vaccines such as Moderna or J&J that may be available?
Yeah. So a couple of answers about that. As you said, Senator Cardin, the current plan is 2 vaccines, two shots given 3 weeks apart of the Pfizer vaccine. I think we're going to have to see what we will need, if anything, in terms of boosters. We don't have that information yet. I think for all of us who like to plan ahead, the pandemic has been an interesting lesson in patience. And I think it applies here too. We will certainly in the context of these studies, these children will be continued to be followed. So we will get information about antibody persistence and also the epidemiology of COVID going forward that will help us better understand when additional doses may be needed. In terms of the Moderna and the J&J vaccines, the Moderna vaccine, those data are still being presented to the FDA and discussed with the FDA. So we don't expect an immediate approval for use of those vaccines in children. It likely will come with time, but not immediately. As I understand it, the J&J studies in children are just beginning. So it will be many, many months before we have data that could go to the FDA. So I think the message for our 5 to 11-year-olds is they should be getting the Pfizer vaccine now, and they should be getting those 2 doses, and then we will follow and plan accordingly.
Dr. Hoover, our children are back in school primarily. Do they have adequate support there to deal with the consequences of COVID-19? We recognize that, well, let me first say, Congress has provided hundreds of billions of dollars for our school systems, recognizing there is going to be a catch-up situation. They're going to have to deal with the challenges of COVID-19. But I really want to focus on the mental health issues and the public health issues. We provided money, but are there resources, are there personnel? Do we have the support services we need in our schools to deal with the challenges that have been caused as a result of COVID-19 in our school system?
Great question, Senator Cardin. And first, I do want to say, again, we're grateful that Congress has provided almost $200 billion to schools to address the aftermath of COVID at our state and local levels. And this money, in large part, is being used to address learning loss. But we know all states and most local communities are using some of the funds to address the student and staff well-being and connectedness and mental health. Do we have enough? I think we could always argue that we need more in place to support student and staff well-being, but schools are putting tremendous effort into staffing up. So many are hiring more school psychologists, school counselors, school social workers to really ready up for the mental health needs that are showing up. We've seen real increases in mental health concerns as schools reopened this fall. Unfortunately, we are seeing workforce shortages. So there are a number of communities that are saying that they're posting for school social workers and school counselors and psychologists, but just aren't able to fill the positions, especially in some of our more rural communities. So that's a concern. And I think it's a longstanding issue that we need to address from a resource perspective in terms of workforce pipeline issues. We also know that it's not just about putting more treatment providers in schools. It's really critical that we put more universal strategies in place, both to detect mental health concerns. So a lot of schools, for example, are putting more screening mechanisms in place, well-being check-ins. It's really important that we think about early identification mechanisms. But also it's critical that we be implementing kind of universal curricular strategies to promote mental health for all people in the schools. So that would include things like mental health literacy, and a number of states are in fact requiring mental health literacy now, K through 12, and social emotional learning strategies. And the other point that I would make that a number of states are considering is how to best invest in staff well-being. So if we want to take care of our children in schools and our children's well-being, we have to simultaneously pay attention to and invest in our educator well-being. We know that they're suffering in many ways, more so than many other professions right now in terms of their levels of burnout and stress. So it's critical that we invest in that as well.
Yeah, that's an excellent point. The workforce issues, we generally think, well, we have a workforce shortage in primary providers of mental health services, and that we have to do a better job. And you're absolutely right, we do. We need to have more resources and in those areas. But our school personnel, our teachers and our administrative staff and our support staff, they've also been under tremendous stress. And there are issues there on workforce development that we need to deal with in that regard. Let me just give you a heads up. If you look at what's included in the reconciliation budget, if it gets to the finish line, and we certainly hope it will, maybe as early as this evening, I'm an optimist. I serve in the Senate. One of these days, I think we'll actually be voting on this. But it does deal with some of the workforce issues. And in Maryland, of course, we had the Kirwan Commission and their recommendations. Part of their recommendations deal directly with the point that Dr. Hoover, you're mentioning, is to have the support staff with support resources in our schools to deal with the type of challenges you're talking about. And as I was explaining to some legislators yesterday, the reconciliation budget will actually support the efforts of the Maryland legislature in implementing the recommendations of the Kirwan Commission. So we do recognize that as a major challenge that we have in dealing with our schools. And if a child it has an issue, or a teacher or support staff have an issue, that can detract from the educational mission that we're trying to achieve. So we have to deal with it. We've dealt with nutrition. We also have to deal with mental health. So it's a very good point, and one I hope we're going to make some progress on. Dr. Karen, I want to get back to a little bit of visionary as to what you think we're going to see. Are we going to need booster shots for now until eternity? It looks like this virus is going to be with us for a long time to come, either as it currently is understood or through variants or through new viruses that appear in our community. I can tell you that we are appropriating substantial resources to be better prepared than we were for COVID-19, that we'll have the ability to respond quickly. I want to acknowledge that although it's been a long campaign, including the vaccine distributions, it's been done in record speed. The development of vaccines and the distribution of vaccines have actually been done in record speed. And that's a credit to the incredibly talented people that have been involved in the development of our vaccines and the distribution of our vaccines. But in the future, I've heard from some that, maybe we'll get a booster shot once a year. Maybe it'll be part of a flu shot, one common shot that you get for the flu and for the virus. Maybe we'll go to a different platform vaccine, which is called, as I understand, a living vaccine as compared to the current platform that we have. So what do you think looking forward? I know I don't want to detract from our effort right now to get our children vaccinated and everybody vaccinated with the current vaccines that are available. But what do you think the future looks like for vaccines to protect us on an annual basis from the risks that are out there?
What a question. Well, so a few things just to say about that. The first is, I actually just wanted to take a moment to, thank Congress for funding NIH research and NIH investigators. Because while we had significant hurdles related to vaccine rollout, the research and development and the clinical trials, I think what happened in 2020 was absolutely extraordinary. And it was possible for two reasons. It was possible because we had investigators at the NIH and their colleagues who had been working on related coronaviruses for years, with understanding that, it's important to understand the biology and the science behind these in order to be able to develop those vaccines in record time, the Pfizer and Moderna vaccines. And we had seasoned, exceptional clinical investigators who could work on the ground at Hopkins, at the University of Maryland, and all over the country to evaluate those vaccines using the highest standards. So I think what we were able to accomplish in 2020 was great, and I just have to give a shout out of thank you for that. But to your second question about what does the future hold, I think we need to follow the science, as we have said over and over and over again. We need to understand the epidemiology. What is likely to happen, and this is those of us who've worked on respiratory viruses for a long time are not surprised by this, is ultimately vaccines may not protect us from any infection. What we hope they will do is they will prevent serious infection, so that you or I or Dr. Hoover might actually get infected with COVID, but have a runny nose or a cough, or maybe not feel very well for 24 hours. But one, we may not get very sick ourselves, and two, we may not, importantly, pass this on to our family or to our neighbors or our schoolmates. So what I think we're going to need to do, I know you've asked for a crystal ball, but I think the information we're going to need is we're going to need to look at people's immunity over time. And we're also going to have to look at the evolution of the virus, right? Delta really set us back. And you commented, Senator Cardin, on the effect of Delta, particularly on our children. And that is an absolute fact. We had a huge spike in pediatric hospitalizations in August, September, October. How many more tricks does this virus have up its sleeve? Some virologists believe that we're getting toward the limit in terms of how much this virus can mutate, but we're going to have to follow that. We're going to have to follow where the virus goes, and we're going to have to follow human immunity. Certainly, we have the capacity to make vaccines where we give flu and a COVID vaccine simultaneously, but I think we need to follow the science and see where that takes us. And I don't think we have an absolutely clear picture yet. Sorry to say.
Well, I think that's fair enough. I recognize that. And we know today we need to be vaccinated, fully vaccinated. We know the advantages of booster shots. And we know those that are not vaccinated need to get vaccinated. And now anyone over the age of 5 can get vaccinated in this country. So we are really at the point where we could really control the future of COVID-19, and recognizing it's something that will be with us. So we're going to have to continue to pay attention to make sure we're fully protected moving forward, particularly if new variants emerge or new virus emerge. So I don't want to crystal ball it. I want to give NIH the resources they need and give the scientists the tools that they need to keep us safe, and we'll continue to do that. So I have a question for both of you. I'm a parent, or and my child has certain symptoms. I'll do it from both points of view. Let's say those symptoms are attention or certain things that could be interpreted as a challenge for mental health and may need some attention. I might say, well, that's probably just because we've been locked up together for a year and a half. She'll get over it. So when do I notice behavior that I should seek to have help in intervention from a mental health point of view? And Dr. Hooper, when you finish that, I have one for Dr. Karen on the physical side. But let me start with you as a parent and noticing some unusual behavior from my child, but saying it's probably just because we have had to be together so much.
Right. Well, as a mom myself of 3 teenagers, I can tell you that I've had that question on many days. Is this typical, or is this just a result of being all in one confined space together for 18 months plus? Or is this something I need to be concerned about? And it really is a question that we're hearing a lot from families. And it's an important question to ask, and it can be hard in any moment in time to distinguish between what is typical behavior, for example, in adolescence, what's typical kind of mood changes that we would anticipate during adolescence versus what's something that we need to be concerned about. It's important to reality check, and you can do that with your friends, but also with your primary care providers, with school providers like your school counselors, your school social workers, and psychologists or other mental health professionals. In general, if you are seeing behaviors where your child, whether it's a young child or an adolescent, is isolating themselves, if they are displaying mood reactions or behaviors that are really out of the norm, they seem much more reactive to situations than they might otherwise, it's a good idea to ask questions to seek help. Again, you don't have to go directly to a mental health specialist. You can seek your primary care provider's input. You can even speak with your school educator. Our educators are increasingly equipped to navigate mental health questions and concerns. So as a parent, our best advice is reach out when in question. And there are some signs and symptoms that you want to be mindful of, like isolation and significant mood swings.
Thank you for that. Dr. Karen, as a parent, my child gets colds, gets the flu every once in a while, and we take care of that with our home remedies. In the COVID-19 environment, when should I seek to go further than just home remedies if my child is sick?
First of all, this is a reminder again that it's time for people to get their flu shots if they haven't already done that. I think it's really very, very important. I think in terms of illness and when to consult your provider, I think if there are symptoms that concern you that are symptoms that are beyond a typical cold, I think if I'm understanding, you're asking two different questions maybe. One is about the health of my child. One is, could my child have COVID and perhaps be at risk of spreading it to somebody else? And those are maybe interrelated but not identical questions. So I think in terms of the health of my own child, I think, one of the things that I think is really helpful, and it is difficult as we have children back in school, as they absolutely need to be, and as we're in cold and flu season and have had some viruses circulating out of season besides COVID that are causing a number of illnesses. I think it's hard sometimes to distinguish between those two. So schools are now doing some COVID testing. I think the fact that President Biden is working so hard to make rapid tests available is all to the good. We've been behind some other countries in that, and I think it helps us certainly in our decision making in terms of the individual child's health. Certainly, if a child has a high or persistent fever, is not acting like themselves, is more tired than usual, I think that is certainly a time to get in touch with your provider.
So let me ask you a question about those under the age of 5. Is there any studies being done as to any vaccine for that age group? Or are we sort of going to let that go by and recognize that once they turn 5, then we can get them fully protected?
No, in fact, Pfizer in particular, Moderna is working on this as well, but Pfizer has started has ongoing trials in children ages 6 months and above. It's expected that there will be results of those trials to share with the FDA probably at the end of this year or the very beginning of 2022. So I think that we will be able to see information about those trials and provide that to the FDA, to the CDC, and then ultimately to parents. I know that's a big question on many parents of infant and preschoolers' minds right now.
That's good news. I mean, it is really record speed when we think about how this has been brought out. The urgency, because most of was emergency use to start off with, and then going through the full process. So that age group, the infants, are not quite as vulnerable from the point of socialization as those that are in schools. But let me just remind people, part of the reconciliation budget is for universal pre-K for 3 and 4-year-olds. So we are talking about and I think most parents would like their children engaged in early childhood education at a very early age. So we do have the interaction, and it's important that we figure out ways to protect everyone in our population. So it's good to see that we are planning ahead. And I just really want to underscore the point that both Dr. Karen and Dr. Hoover made, and that is the resources that we provide for basic health research is critically important at NIH, and the funds that we provide for public health are critically important for our community. They've helped us in getting information out during a pandemic, but they help us throughout the year dealing with the health risks in our community. For too many years, they have not been a priority for funding. I think we've learned our lesson, and we want to make sure that moving forward, that these programs are priorities for us to be properly prepared. We were not as prepared as we needed to be for COVID-19. That is absolutely clear. The direct impact as well as the secondary impacts. We need to be prepared moving forward, and that means adequately funding the agencies that are charged with these types of responsibilities. I want to thank both of our experts for joining me today, Dr. Ruth Karen, the professor, Department of Pediatrics, the School of Medicine at Johns Hopkins University, and dual-hatted as also a professor of international health at the Bloomberg School of Public Health at Johns Hopkins, and Dr. Sharon Hoover, the co-director of the National Center for School Mental Health, University of Maryland School of Medicine. Both of you are extraordinary individuals helping our community. We thank you so much for everything you do. Thank you for sharing your expertise with me on Facebook Live. I know our audience appreciated your input. Everybody stay well, and thank you for joining us today.